All right, it looks like we've got almost everybody here, so I'm going to go ahead and get started. Appreciate everyone attending today. I promise we'll have lunches for everyone next time, and I'll go through when our next steering committee meeting will be in May. But again, thanks for being here. Won't be too long of a meeting today, so I'll go ahead and get started with the agenda. So we've already sort of done welcome and introductions. Not going to make everybody introduce themselves again, and we sort of did that last meeting. I'll go through just a recap of some of the key takeaways from our meeting last month and some follow-up items. We'll give a quick review of the 2016 plan, some of the goals and objectives from that plan, and give you all a chance to provide your feedback on, what has happened since then, and, what kind of progress we have made in relation to the objectives and some of the strategies that were outlined in the plan. And then I'll lead us through a public outreach discussion, sort of zooming out a little bit, talking about, sort of what our goals are in terms of the survey, questions we need to be asking, as well as outline some of our first public outreach events that will be taking place. First one is next week, and then a couple of next steps, and then we'll get you guys out of here. So last time, I think we had a really fruitful discussion on the plan's public outreach strategy. I think a lot of you provided some really useful information on the lens that we should be taking in terms of how to gather information, who to involve. And I think today we want to dive into more detail and get feedback from you all on that. We previewed the survey outline and some of the outreach events, and then we outlined how we're expecting you all to be involved as we go forward throughout our outreach. And then we talked about a few potential opportunities, which I'm sure you all might have additional ideas. I heard from a few of you over email on events that your organization hosts and other events that we might want to attend to gather information for the plan. So at this point, I'll hand it over to Shay and Debelina on our team to walk you through a review of the 2016 plan.
Hi, everybody. Good morning. I will walk you through the goals as well as what are the gaps.
Debelina and Shay, I think you guys are muted.
I can hear.
Yeah, Daniel, I can hear them.
Can you hear us now?
I can hear you as well.
Mm-hmm. Okay, thank you. Yeah, so I will walk you through.
I'm still not hearing you. You might want to check the settings.
I'll walk over to Daniel. Debelina, keep going.
Okay. I will walk you through the goals as well as the gaps identified in 2016 plan. So as we all know, in the very first meeting of the steering committee, we talked about the goals of 2016 plan. Again, to review that goals, I would like to say of the 2016 goals, the focus was more on to having more and more quality transportation with more number of communities region-wide for the elderly people, for the veterans, people with low income, people with disabilities, etc. At the same time, it was also focusing on having more and more awareness about the services, as well as more connected and region-wide with more accessibility, more mobility, ridership, etc. So if we having concentration on all these goals, which has already been described in 2016 plan, there were 5 areas which they identified as the gaps which were prevalent or existing. So if we go through the next slide, we will see that those 5 areas where they identified the gaps, there were information and awareness, geographical, client-based, time-based, and then service quality. So if we talk about each of these aspects, like if I talk about the information and awareness first, then there is a lack of public information on the available or the current services. For example, suppose I'm a daily rider for the bus over here, but I want to get through the bus, but I don't have the proper information about at what time the bus is leaving. The bus is taking me at the point where I want to go. So these kind of detailed information, sometimes they are the proper education is not there. This kind of accessible information is not among the public. So these are the information and awareness lacking problem the public faced. Then if we consider the geographical gaps, then obviously the gaps lying in the lack of service to the key activity centers, then obviously the lack of first and last mile connection. Like suppose people are going out of the county or the region, but there is not available option or much available option when they want to come back to their home from the other region or county. And there is also lack of coordination between the land use and the transportation policy. That's why a lot of transit-oriented developments are not happening. So if we go to the next slide, that is the time base. It is mostly the services are not available for the weekend or the late night or the evening services where people generally go out or they want to have some important appointments on those weekend days, or they want to meet the friends for more social activity. So these kind of services are not available for them on those weekend or extended hours, I could say. For the client base, obviously, we see that there is a lot of options for the veterans, for the elderly people, but somewhere we are lacking to provide the same kind of service quality for the people who are having disabilities, for the people who are in the low income group. So we need to cater, the inclusive approach is still missing there. Somewhere, some people are getting more facilities or there are more options available for them. So the same is not available for the other. So we need to have that inclusive approach for all. If we consider the service quality, then obviously we need to see beyond the ADA thing, like we need to have the proper facility infrastructure, even for the bikers, for the pedestrians as well. And also there is low frequency of services. At the same time, I think the general public also, some those who are also living in the low income group, the general transit, the public transit, that concept is also lacking. So we need to see beyond this ADA act for this to improve the service quality. Now I would invite Shay to focus on more where we are actually lacking this and how to come up with more solutions.
Thanks, Devlina. So as we look to this current plan update, we really wanted to go back to our 2016 plan and review the objectives and the gaps, as Devlina talked through, of where we were in the past and where we're going with this current plan. So we just wanted to have a little bit of a discussion with you all, with your perspectives in your perspective organizations. Where do you think we are in comparison to what our 2016 plan was? So just kind of first, kind of kicking it off with, to what extent do you all think that the objectives of the 2016 plan were met or are currently being met?
I think services have expanded a little bit, based on the volunteer driver programs that are now in Wilson County and Sumner County.
Great, thanks. And you all can share in the chat or unmute and share out, whatever works best.
Yeah, this is Ed. As I listened to and saw the goals and objectives from 2016, I didn't see a single one of those that I felt we could say we've done that. I think we've made good progress, but I think those goal statements are still very valid in 2024.
Absolutely. Are there any other ideas about any of the goals in particular that we think that we need to focus on or are being met? Any specifics from those? Daniel, can we go back to that slide real quick, just so people can look at it while we're chatting?
Billy, you mentioned expanded service in Wilson County. Could you talk a little bit more about what allowed that and, you know, your personal assessment of if that has been effective and, you know, if there's any lessons learned from that?
I think that there was a personal commitment from the executive director of Wilson County Rides, and then the support. They garnered support at the local community level, and then they've built up service and they've secured funding to improve and expand upon what they're doing. And they started from nothing about 2 or 3 years ago. And the same thing for Sumner County. I mean, Sumner County started with a few dedicated people, just like Davidson County with Senior Rides Nashville. It starts with 1 or 2 dedicated, committed people, and then tracking down funding from a local level as well as other funding sources.
I got a question on number 4. It says increase the number of communities in the region. So that's a pretty general statement. I mean, were there specifically communities that were targeted? Billy just mentioned some geographical areas, but like in the 2016, was there ever identified that these are communities that we wanted to do this increase?
Yeah, I mean, I think well, one being, you know, number of communities that weren't served before. So, you know, Billy mentioned Wilson County and Sumner County, but I think it was also tied to our target populations and where they reside and where, you know, those populations live within the region and what kinds of services they have access to versus, you know, the gaps in service. So I think it was, based on my reading of the plan, I would say it was prioritized based on, you know, where access is currently and, you know, where those people live.
Okay, I guess I would just suggest that maybe that would be something that you know, we obviously want to increase the number of communities, but it would probably be appropriate to think it all the way through and let's maybe identify some areas that we'd like to target so that we're all thinking in that kind of mentality when we have conversations with, you know, different folks that might be able to get things started in that area, or ones that have reached out to you guys and said, hey, we you know, mayors and things like that, so we'd like to see something happening, because sometimes that's just too general of a statement to kind of be thinking in those terms, like, well, okay, well, let's knock out these 3 or 4, you know, each year to try to get that happening.
I think that's a good point. And I think, you know, as we go through this process and we talk to users as well as providers, because you all are well versed in not only where you provide service, but you probably hear from riders where they need service and don't have it. So I think that's something that we're hoping to fill the gap with as we go forward and we learn, you know, Houston County you may be able to leave Houston County, but if you're going to a county that's not covered under, you know, Mid-Cumberland or whatever other service people are taking, then we want to sort of have a better way of mapping out exactly where service exists and where the gaps are.
Mia, did you have a comment or question?
Yeah, actually both. So
Okay.
as I was not here for the 2016 plan, I'm actually more listening than anything else. But my question is really about the drivers. You know, the conversations that we often have on our end is that a lot of these services would love to do more, but for those who have drivers that are based on volunteering, they don't have enough drivers. And so to me, it appears that before conversations about expansion need to happen, perhaps a larger conversation needs to be around the best way to recruit the drivers so that you can expand and can have the available service that people are looking for.
Yeah, I would totally agree with Mia. I think we need to cite that, and I think some strategic planning work that Senior Ride Nashville has undertaken is supplementing or complementing, however you want to look at it, the purely volunteer driver with drivers that are receiving some minimum compensation for the trips. And the long range view for Senior Ride Nashville is that's going to be a critical source of driver resources, is to have that an additional capability. The advantage, of course, being that with paid drivers, you can schedule, you can get commitments that are a little difficult to come by when it's all purely volunteer. And I would just, while I've got the line, I would just go back to Billy's point too. I think in looking at the services that do exist now that did not exist in 2016, I think Senior Ride Nashville and the other services comparable to that in Wilson County and Sumner County are clearly something we ought to note, because we did not have those services at all at that time.
Yeah, that's a great point. And I think, Mia, to your point, and Ed's, one of the goals of our outreach is to hear from providers about how things are going within their organizations, and hear those needs. So that's definitely one of our goals when we're wanting to hear from providers. Mia, did you have an additional comment as well?
No, I don't. Thank you.
Great. Great. So great discussion so far on our objectives, and we've kind of talked about the gaps a little bit as we've talked about those objectives, but we'll just take a moment to see if there's any additional comments on the gaps that we've discussed that Debelina went through. So are the gaps identified still present? And if so, where are the gaps? And then if the gaps, what do we need to do to fill those gaps? And maybe we can go back to that slide with the gaps on it, so we can review what those 2016 gaps were.
Mike, I saw you unmute, but I don't think we could hear you. I don't know if you were trying to say something.
No, I didn't have any questions. I think the bigger question is what we already started talking about, is the need for drivers and to try to get folks in here to make the magic happen.
Okay, great. Yeah.
Could you explain on the client base, it says need for expanded service options, then / eligible riders? What does eligible riders mean to you in this context?
I think what we were thinking based on eligible riders is there are, from what we've seen, there are more options available for older adults than there are for veterans or people with low income. There's more like dedicated service across the region. And so, you know, we struggled to identify, like we saw call out service for people with like Blue Cross Blue Shield, or to specifically dialysis centers. But we didn't, you know, veteran service isn't necessarily available in every county. And, you know, there aren't demand response services in areas that may not have fixed route. So that's sort of what we were thinking in terms of our target populations. Are there different needs based on, you know, who is an older adult, who is a person with low income, who has a disability?
Okay.
Any other questions or comments on the gaps from 2016? Okay, so we will move forward to kind of how are we going to capture this information? So this is going to be an ongoing discussion, and Daniel's going to speak to this further in a moment, but just generally thinking and asking, how can we learn about the current state of these objectives in our outreach? What is the best way to capture this information? So this is an ongoing question that we're asking, and would love to hear any ideas or feedback that you all have about how the best way to capture this information would be.
Yeah, a quick question, and you may have covered this when we met before. The how much work do you all do in looking at other comparable regions across the country? I know when we created the whole concept of Senior Ride Nashville, the most important work we did was to look across the country and see what programs existed. A lot of the detail work that we would have undertaken, we didn't have to because models were there that had already dealt with those questions. So I'm wondering here, as you look at the sort of comparable regions, and that's kind of hard to define, of course, but comparable regions, have they gone through this same process? Have they identified gaps? And do those gaps relate to things that we're concerned about as well?
So I think that's a great point, and the answer is yes. We have done an initial peer research activity where we've looked at MPO regions in North Carolina, in Kansas City, and I think we've seen areas that are ahead of us and have blueprints that we can follow, like free transit service and increased frequency, and sort of I think what we've been focusing on this time is taking a more comprehensive look at transportation for these populations and how it's not just related to demand response. It's also, well, how can we get them to take fixed route? Are there infrastructure pieces that we're lacking, and taking a more comprehensive look? Because I think that when we've looked at the other plans, that's what we've seen. And I think as we get into more discussions about the strategies that we can be taking as a region to accomplish, expanded service and free transit and any of those other things that we might want to consider, I think that it's good for us to look at other regions and how they've accomplished that in the past, because I think that we're pretty behind compared to a lot of other regions, and they have a lot to offer us in terms of solutions.
All right, I'm going to pass it back over to Daniel to talk more about our outreach efforts.
All right. Thank you, Shay. Thank you, Debelina. So just as an overview to remind you, components of our outreach plan includes surveys and individual questionnaires, which we're going to get into, 2 to 3 public outreach events at senior centers, veteran centers, and other community spaces, as well as one-on-one interviews with you all. So just as a reminder, these are sort of our objectives. We're looking at this from a little bit of a different perspective than we did last time. It's not just based on transportation services, but we want to hear the story of individuals who are actually using these services or not using the services. So we want to hear from community members. We want to share resources for those transportation options that are already available. We want to place emphasis on outreach to our target populations, plan events in different counties, as well as create inclusive outreach events. So I think what we want to accomplish today, since you all are a pretty diverse group of providers and users, I think, the first question is, who do we want to hear from? And I think what we've talked about internally is, breaking up the providers into, public transit agencies and those demand response services that they offer, as well as fixed route. Human resource agencies like Mid-Cumberland, and then nonprofit providers like Senior Ride or Wilson Rides with volunteer drivers, and maybe not in the future volunteer, as well as staff and operators. And I think one thing we've talked about internally is talking to drivers and operators in each of your agencies. And I guess my question is that feasible? Do you know operators in your agencies that would be willing to sit down and talk about some of the issues that they face on a daily basis, as well as, getting, into more detail into, why getting drivers is more difficult, what needs they have. So I'll just pose that question. In terms of providers, are there other people we need to be hearing from? Do you all think that this is a good list and we're thinking about it in the right way?
I think it's a good list, personally.
I'd like to hear from other nonprofits that may not be providers, but other ways that we could provide service to their clients.
Are there specific providers that you're thinking of, like maybe healthcare providers or others that interact with our target populations, but may not actually provide that transit service?
Other nonprofits that represent populations that we're looking at, like reaching out to Center for Nonprofit Management or Community Foundation in Middle Tennessee.
Right. Those are great points.
I also, go ahead.
No, go ahead.
Yeah, the other thing I think you might want to think about and add to the list, there's a lot of faith-based organizations, churches. There's churches that have pretty extensive bus programs, getting people and kids to work. There's a lot of faith-based organizations, churches that want to make an impact on their cities, their neighborhoods. That a lot of these issues are transportation related. They got little buses, they got little vans. They're somewhat sophisticated in setting up a network of how to be involved. And I think we got a lot of big churches in Middle Tennessee that could, I think, welcome the chance to participate and help in their communities if we talk to them.
That's a great point, Stan. I know that specifically there are churches that provide transportation service to the Symphony in downtown Nashville, and I've seen them many times. So I think that's a great point as well.
I totally agree, and this is an amen. But I also think there are a number of churches and congregations and synagogues that don't provide those direct services, but their members and their participants are wishing that they could.
Right.
So it's not just those that have the buses, which are extremely important, but also engaging with the faith community. This could help address some needs that they're beginning to hear, particularly as the role of church in society is broadening beyond just a worship service experience.
Right.
I would add just one other very broad category, and that is, as hearing from people, is to not miss the opportunity to get input from other efforts that are underway to gather this kind of input. And even though I know we're not limited to Nashville, the Imagine Nashville survey work that was done has a lot to say about what people are interested in terms of their transportation options. And I think a lot of that information is relevant, whether it's Franklin or Nashville or Gallatin or whatever. So I would, and then some other communities have also done these community-wide surveys on what people are interested in seeing improved, including transportation. So I would just make sure that, and I'm sure you're doing this, but just to be sure and glean from that work that's already been done and already paid for and validated, glean from that evidence and input of what we hear.
So I think that's a good segue into these two other buckets, users and local representatives. So I think, what I don't think we talked about last meeting that we sort of thought about internally is, we feel like we already know a lot about some of the issues that the target populations who use existing service face, but for, as you mentioned, Ed, for folks who don't use existing service, understanding why they don't use existing service, what barriers are there that prevent them from using existing service, and maybe what would need to change for them to access services. And I think that's the kind of thing that we might learn at senior centers and at these public outreach events where folks are more willing to share about some of the issues that they encounter. And then I think the other thing you said that sparked an idea in my head was local representatives. I think not just Imagine Nashville, but any planning effort or elected officials, planners, local staff from any of our communities across the region, they're more in tune with their residents' needs and may have information to provide that would be helpful to us. Any other thoughts about these three?
I was just going to mention to Ed's point about organizations that are already doing the work. As we're having these conversations about the transit plan that the mayor is working on, they are having a lot of these conversations. And one of the questions that they're really focused on is why aren't people using the existing services? And so, instead of recreating the wheel, that might be an opportunity for you just to take some of that information. And that'll be one less piece you'll have to do some legwork on.
I agree. That's a great point. And we're already pretty plugged in to that effort. So I think it would just be as simple as reaching out to that project team and making sure that we have an opportunity to also ask these questions.
I also feel like whether it's nonprofits, whether it's senior centers, whether it's medical folks that are serving different, some of them are hospitals and some of them are clinics and some of them are really focused on the underserved. We talked about churches. We talked about access and why don't they use it. I think in public transit, like the reason they're not using it is a lot of times they've never tried it, they've never thought about it. So I think if it was me and I was king for the day, like let's just talk about veterans, for example. Like I think it'd be great to have a commitment that every transit agency that has fixed routes, we don't charge for, in Franklin, we don't charge for veterans, for example. Maybe some others don't. And, you mentioned earlier about free, transit, things like that, and that's controversial. But I feel like we should be able to maybe use some of the funding to give out as many free tickets to as many organizations that have connectivity to your groups that you're trying to access. Seniors, people that haven't tried it, low income, they can't afford it, whatever it might be. And let us just give these tickets out throughout the community. Free is always a great thing. And then if we could almost reverse, a lot of people say, well, we don't want to make it free. Well, you don't make it free, you're giving them away, but maybe there's a way that the transit agency can recap by tracking the tickets that are being used and get reimbursed so that it's free for the customers. We're doing great work, and at the same time, the agency is not bearing the free rate. It comes back from the state or come back from a fund that we can access reimbursement for tickets that we're giving out for things that we want to accomplish in our communities. And I don't think we do enough of that. I think it's a pain to track, but if you want to get paid for participating, you track it and you send in the invoice and you get paid back. I think that we're, if you gave out tickets for free to some of these folks and these churches and these senior citizens and veteran organizations, I think they'd be used, and it starts to accomplish what we're trying to accomplish here. And at the same time, we can use grant funds to reimburse the transit agencies that are participating in the work. So they're not doing it at a loss necessarily. They're incentivized to track it, and that way you get all your numbers back too, to show how you're accomplishing the goals of the program.
So other providers on the call, is that an opportunity that you all would take advantage of as well?
This is Mike from CTS. We get requests all the time for faith-based groups, senior citizens, or whatever it may be, for reduced fare tickets or free tickets. We have not done that yet for the fact of where do you draw the line at. So if we got somebody that would pay for a bunch of tickets, we could give them out. That wouldn't be a problem. But that's how we make part of our capital, is by selling our tickets. So we'd have to figure out a way to who's going to purchase them, and then how do we get them out there. Tracking it would be the easy part for us. It's just going to be trying to figure out how do we get reimbursed for it.
Yeah,
And
or
where
the
is it
funds
going?
that we talk about using for outreach and marketing. What better outreach are you going to have than Mike be able to? He knows this community to identify them. So he just puts a request in. I want to put in, I need 500 tickets for these groups, and we're going to give them out free. And
Right.
that's about as good as marketing as
No, I love the idea. I just had
yeah.
to figure out how to pay for it. I'm all over that.
I'll speak.
Daniel's going to pay for it.
I'll speak up for MTA. I'm not a big fan of, or somebody's going to be paying for that service. So to say free, there's some connotations there that we've had internal discussion on. So from agency wide, there's not free service. Somebody's paying for it. So but I see your point. And we do provide service in different ways to get somebody to try transit. And then there's times when we're providing service or to like homeless if it's a cold night or a really hot night. So there's different servicing options in how we do that. And if there's funding available, that definitely can be expanded.
Okay. It's a good thing to think about, potentially including as a strategy in our planning effort of, dedicating a fund or having that be an available use with, federal funds or another funding source, maybe state funds, at least putting that out there. So I think that's a good discussion, and we'll include it in our notes and come back to it later in our planning process.
There is a small portion of the new transit, the proposed transit referendum that is geared toward that, just a very small piece.
Right. And even better if it was coming from local funds.
Yes.
Let me tell you one little story here if I got a second.
Sure.
I came out of Washington State. We had a sales tax to pay for our transit. So if you were inside the county of Mason County, you had a free bus service. The councilman, the mayor, and everybody did not like the word free bus service. It was a prepaid bus service because you were paying your sales tax to pay for the service. So they didn't want to call it a free service because of the connotations around giving stuff away. They wanted to make sure everything we put out said prepaid service for that kind of stuff. So there's different ways of doing it, but we had to go to the citizens of Mason County, I think 3 or 4 times to get that amendment passed before they were willing to pay. I think it was a 0.06 5% sales tax on goods and services, which is Washington State. They do that a lot out there, but that's not a big thing down here from what I understand.
Yeah, that's a good point. And I know Kansas City does the same thing, as well as Chapel Hill, North Carolina. And the cities in those regions are contributing to that. And I think what Billy mentioned with the upcoming referendum, that might be a potential opportunity to include that, which is also a sales tax increase. So, but again, that doesn't cover the entire region. That would just be Davidson County. So that's another conversation we need to have. So I'm going to move on to the next question. What do we want to know from them? We've already covered a few of these, and these are not a completely, inclusive list of questions that we want to ask. But as we're putting together, our potential survey, as well as just questionnaires that we need to be asking at our public outreach events. From a provider standpoint, operators, what challenges do you encounter while driving? How can service be improved? I think to the conversation we were just having, what activities are you not able to fund outside of the MSID and JARC sources, as well as, FTA funding that you're getting? And then from a user standpoint, why don't you use services if you don't use services? If you do use services, are they at the right time? Are you inconvenienced by the timing of service? Could it be easier to use? Are there places that it doesn't go that you need it to? So, looking at the user experience from more of a comprehensive standpoint, rather than, is once you get on the demand response bus, is it taking you where you need to go? It's more about like, can you schedule them? And what other challenges are you experiencing? And then local representatives, what challenges are you hearing about from your constituents? So are there additional questions and topics that we want to consider when we're asking, these three groups for information in our outreach practice?
Yeah, Daniel, I have a concern about the middle group, the user group. When you go down each of those items, everything relates to services. So if I'm taking a survey or I'm in an interview about this, it's all related to services that are already implanted in my mind, fixed route, Uber, whatever it may be. I think one of the things that Nashville is doing with the new campaign that we're undertaking is the theme of choose how you move. And I think when we think of it that way, the questions relate more, how do you get around and how could you get around better? As opposed, do you use services and what services would you like to see? Even though they're addressing kind of the same thing, I think from a survey point of view, services really constrains people more into thinking of the current structures of transportation services, when in fact we're kind of open here to something that's hopefully going to be radically different in the long run. It's still going to require fixed route. It's still going to require transit centers. It's still going to require micro service. But let people talk about what would help them in their lives, and then relate that back from our point of view with current services and proposed services.
So having it be more of an open-ended question.
Yeah.
Asking them about their experience rather than putting something in their mind before they've had a chance to think about it.
I'm a amen this. Almost every question is a negative. Why don't you? Are you inconvenienced? What challenges? I mean, I think there's some success stories. The way we have tried to do things as much as possible is to see, what are people using now to use the different services that they're using currently, even though we don't have very big transit. But birds of a feather flock together. They kind of live in the same areas. A lot of them do the same things. So we worked hard at trying to figure out what are you using the service for now, and then part of our strategy also deal with all these challenges you have listed here is that to spread the word out, in the form of social media and other things that, hey, you can use it for this, other people are doing it. And once you put that in their minds, it might be the first time they thought they can take the bus or they can go do this to get this taken care of where they hadn't. So I maybe just rewrite this so it's not as, I don't want to say negative, but it kind of comes across negative to me. And let's find out, to Ed's point, what are you doing? How do you get around? When do you use this? those kind of things, because, you know, I think that we'll get more out of that on the success side as also the challenge side.
Thank you both. That's really helpful. So sort of having like prompt questions at the beginning to get them, you know, telling us about their experience. Like, how do you move? How do you get around? Because, you know, some people might say, well, my family members drive me around. I don't use existing demand response or fixed route services. And that's, you know, a whole nother bucket of information that is useful. So I like the way you all are phrasing the questions, and we'll rewrite these.
Yeah. And I think it's important to not just concentrate on transit, like Ed said, because, you know, my kids are old and make more money than I do now, and they still want me to pick them up from the airport. And I said, just take an Uber. And it's like, well, you can pick me up. No, take an Uber. It's $36 if you come in at the right time, and that's plenty. I'll pay you back. So, you know, and if they're Uber users, that helps transit people know what kind of service to bring into an area. Because most likely, you know, if they live in a particular area and everybody's using Uber, if we do come in, you know, we probably aren't going to bring fixed routes. We're going to bring something else in there, because they're not going to switch from Uber to fixed route, that they might switch, you know, from to a microtransit or something like that. So I think it's all important to know how they're moving around.
Right. Billy, was that the thought process that you all had when you introduced the Uber link?
Yes. See what's out there. We've had services. The 76 is a great example that serves Madison now on a regular hourly basis. It started out as a WeGo link zone.
Was that based on outreach to existing riders and/or, you know, potential riders that you might want to bring in to use the service?
Yes. And it's tweaked. I mean, that's how we make service changes, is we're reaching out to riders on the bus and then potential.
Have you all been tracking ridership on specifically the UberLink service, but also riders that are using that, you know, in which ridership lines they're going to?
I believe so. Phil might know. He's on the meeting as well. He might know more of the details than I do, but I believe we're tracking it and looking at it from different options. It's different. It's our service quality department that starts looking at stuff, but some of our planners also look at that when looking at different routes. It's part of what we did with North. There was a lot of outreach with North Nashville and the rerouting that we did this spring.
Right.
Combination of data sources.
Any other thoughts on this question? All right, we'll move on to the final one. So in what ways would we be able to ask those questions? We've talked internally about a couple different options, a traditional survey that, you know, would have an online option, as well as for some folks administering a survey in person. But I think the discussion we were just having leads me to believe that, you know, more like one-on-one interviews at outreach events where we're asking people to tell us about their experience might be more effective. So those common destinations, Veterans and Fairs, dialysis centers, major employers, you know, we've talked about connecting with the workforce development community, Department of Health, as well as our in-person outreach events, to ask those more experience-based questions of how do you move, based on all of your experience gathering information from these target populations. Is it still worth having a survey online, you know, as just an option, and then being more intentional about going to specific in-person places and talking to people and understanding their experience, sort of having a joint approach in those two things? I guess, you know, what are your reactions to these types of ways of gathering information, and are there additional ways that you think we should consider?
I think you go to the locations like at the Veterans Fairs, just, you could hang out at the VA and where all the VA locations are, and you certainly could talk to a lot of people that will tell you their feelings on transportation. Same thing at the dialysis. I think those are really two good places that you could get some pretty good feedback, good and bad.
Mhm.
I think a combination, if you did a traditional survey, if you asked the additional question at the end, would you be interested in providing more in-depth answers?
Mhm.
And just provide your email or telephone number.
Right.
I know getting on the bus always helps find out information about current riders, but it doesn't tell you about folks that are not riding.
Not riding,
Right.
yeah.
I mean, the current riders are going to tell you, I want later service, I want more service, I want more frequency, I want different locations, I want closer to my neighborhood. But it doesn't tell you all the folks at Walmart that are driving there. Why didn't you get on the bus? So some of the bigger locations for us would be like the Walmarts and the hospitals and that kind of stuff. If we were going to be doing an outreach event, if we did an outreach event at the transit center, you're not going to get but just those transit folks coming in there. You
Right.
have to go outside of the norms to try to find those people, like the VA hospitals and that kind of stuff. So I would agree with that.
I think that's a great point. And that's what we were thinking with major employers like Walmart, Goodwill, other places that, we know seniors go to. And I think that's another thing that we could use your help with in your communities. What are the places where people go? So that we can know where to target and where to, conduct interviews and seek out people to gather information.
And Daniel, this kind of goes back to the earlier conversation too. I still think that like one-to-one interviews, they're very expensive and you have to do a lot of work to get a sample base that you can rely on. On the other hand, a lot of that work's already underway. And again, I will just talk about Nashville. The Imagine Nashville effort was a major effort. The Vanderbilt poll people also do some of this.
Right.
It's more survey form based, but it's the same kind of an approach. And so in saying, here's what we have found in our survey, I don't think there's a thing in the world wrong with saying, here's survey evidence from other studies, other efforts, and here are their conclusions. And then we've taken our smaller sample, and I think what will happen is you'll find you're reinforcing what others have already heard. And that just kind of doubles the impact. I think the Choose How You Move effort in Nashville right now is saying over and over again, there have been over 60 studies done on transportation planning in the last decade. And this effort we're undertaking right now is going to build upon what we learned in those efforts, as well as what we're doing specifically today. That's kind of a milestone for planning type people. I'm one of those, because I think often we feel our survey is the only one that counts, when in fact our survey may be a good amplification or reinforcement of work that others have done, and that gets more impact without having to spend massive amounts of survey money.
Right. I think that is a great point, Ed, and I think it reinforces what we've been thinking throughout this
Good.
entire process. Is we don't want to reinvent the wheel. We want
Right.
we want to make things simpler. And I think what we were thinking for some of the questions in the traditional survey is exactly what we were just talking about. Not having a lot of questions, having a more experience-based questionnaire of how do you move, and what issues are you experiencing, and what places do you need to go, that kind of thing.
Yeah.
So great point.
This doesn't pertain to the questions asked, but maybe how you reach out. The efforts that MTA and RTA and NDOT are going to be doing, so updating the in-motion plan, as well as a bunch of NDOT plans for walkability and the major thoroughfare plan, and that combined effort would be more than welcome to tag along with. I think the outreach maybe a month or two behind, but there could be some possibilities for joining up on those efforts.
That's a good point. We'll keep that in mind. Any other thoughts?
You got Department of Health down there. I'm just curious, tell me exactly what your thought was on how you would approach them and getting information from them.
I think it's similar to Veterans Affairs or places that our target populations go for information or services, as well as the employees at the Department of Health. Like, what are you hearing from people that you're interacting with, and services that your providers or services that you are providing to folks?
And then they have outreach or branches in each county. Is that a correct statement? Department of Health for Statins?
I believe so.
So that would be that's an interesting one, because you'd be able to really get a good feedback from a lot of counties.
Mm-hmm. All right, so I'm gonna close it out. A couple of things. So our next steering committee meeting, May 21st, we'll be meeting in person at the GNRC offices, and we'll have lunch, I promise. But I think the first two outreach events, and I'll just move to this slide. If all of you, especially the providers, could, and we'll include this in our follow-up email, but if you could email me and let me know if you're able to be at hopefully both of these first two public outreach events. Our thinking is to have a provider table where you all will be set up to talk about the services that you provide, as well as answer questions from folks who are participating in the event. Obviously, you all have all of that information already, but we were hoping that at one or both of the events that you all would be able to be there and represent your organization. So we'll send out we sent in the last follow-up email information about the event, but we'll send out another email following this meeting gauging your availability for those events. But other than the next steering committee meeting, if there are additional events, I know I got a couple emails from folks where that folks will be at, that we could attend, that GNRC staff could attend and talk to people about their experience and actually conduct this outreach. That would be really helpful. We're happy to come out to any and all events as long as we're available. But other than that, I think that's all we've got for you today. Anybody have any outstanding questions or comments?
Thank you.
All right, thank you all.
Yes, thank you.
Daniel, I've got one question for you when you get all done.
Sure.
Did you want us to bring a table for like a setup for the Ajax Turner one? Like a normal outreach event thing, or is that just we're coming in to gather information, or are we actually doing outreach at that event? I wasn't sure what you were looking for.
I think that we'll probably be able to, Max or Jessica, if you guys are still on the call, we'll probably be able to provide all of the actual like tables, and you guys would just have to come with information about your services. So
okay, so it's gonna be like an outreach event for us. So
right.
Make it like a normal outreach event.
So both of them will be open house style. They'll be so the Ajax Turner, it'll be at their lunch, which they've already got scheduled, and so we'll have posters and stations essentially, and one of them will be a table where you can set up at to talk about your services. Does that answer your question?
Yeah, I'm just trying to figure out who do I bring with me. Do I bring my outreach people with me, or what I'm looking for?
Whoever you think is best to provide information to the folks that are there
okay.
about CTS services, whether it be fixed route or demand response.
Okay, thank you.
Mhm.
That helps. All right.
Any other questions?
Thank you.
All right, well, sorry, Billy, go ahead.
I was just saying thank you. Good meeting.
Oh, sure. All right, well, thank you all. I'll reach out, you know, either this afternoon or by tomorrow with more information and a follow-up. Looking forward to seeing you all soon. Thanks.